In this video, we talk about the surprising role your prostate plays in orgasm quality and how it could be the missing piece behind changes you've noticed in pleasure or performance. Most men only think about their prostate when something goes wrong, trouble with urination, a rising PSA number, or the looming fear of cancer. But very few men, even those well into their 60s or 70s, realize that the prostate isn't just a gland to monitor. It's a core part of your sexual anatomy, and it has everything to do with how intense, full-bodied, and even how repeatable your orgasms can be. It's not discussed much, and when it is, it's often wrapped in embarrassment, misinformation, or silence. But here's the truth. The prostate plays a starring role in pleasure, not just indirectly, but directly. Some researchers and clinicians even refer to it as the P-spot, the male equivalent of the G-spot, because of its unique sensitivity and contribution to sensation. Still, for many men, especially those over 60, this is completely new information, because we grew up in a time when sexual health was overly simplified, often tied to outdated ideas about masculinity, and rarely updated as we aged. Most conversations stopped at just take a pill or it's normal to decline. But what if part of that decline, especially the parts tied to weaker orgasms, less pleasure, or slower recovery, had more to do with how well your prostate is functioning and how well it's understood? We've known for years that the prostate is involved in the mechanics of ejaculation, but the connection between this walnut-sized gland and the intensity of climax is far more significant than most realize. Here's where it gets even more interesting, especially if you've been dealing with erectile changes, performance doubts, or just feeling like things aren't as good as they used to be. Some men, even in later life, discover that when the prostate is directly or indirectly stimulated, orgasms feel stronger, deeper, and sometimes even repeatable. Yes, multiple orgasms aren't exclusive to youth or one gender. They're possible in men, and the prostate often plays a central role. But this conversation rarely happens. And that's unfortunate because knowledge like this can shift the way you think about aging, intimacy, and control. This isn't about being experimental for its own sake. It's about reclaiming a part of your body that's been misunderstood and learning how it may still have more to offer than you ever expected. Let's break this down so it actually makes sense. For most men, the word prostate brings up two things: urination and cancer. Maybe you've had a PSA test, or heard your doctor mention an exam, or noticed the steady increase in bathroom visits as you've gotten older. And it's true, the prostate does play a major role in urinary function, and it's also where most prostate cancers begin. That's not to be ignored. But the problem is, this narrow view leaves out something crucial. And because of that, most men miss out on understanding the full picture of what the prostate really does, especially when it comes to pleasure, climax, and overall sexual response. You've probably heard that the prostate is just a gland that makes fluid for semen. That's technically true. It does help produce the fluid that carries sperm during ejaculation. But what's often left out is how complex and sensitive the prostate really is. It sits just below the bladder and surrounds the urethra, and it contains a dense network of nerves, many of which are directly tied to sexual sensation. In fact, according to a 2021 review from Medical Sciences and several published studies cataloged by the National Institutes of Health, stimulation of the prostate, either during climax or by gentle pressure, can lead to increased intensity of orgasm, longer muscle contractions, and even a full-body response that's different from what most men are used to. Studies cited by WebMD and Healthline have found that prostate-driven orgasms often include more muscle contractions, sometimes 10 to 15 in a single episode, compared to the usual 4 to 8 seen in typical climax. And here's where it challenges another common assumption, that orgasm quality is always tied to the strength of an erection. That's simply not true. It's also worth noting that discussions about the prostate often get swept aside because they're associated with uncomfortable or stigmatized territory. Some men avoid thinking about it altogether, or assume that any attention to this area is somehow off-limits. The Cleveland Clinic, Johns Hopkins, and countless sexual health researchers have emphasized the importance of understanding the whole pelvic system, including the prostate, in achieving healthy, satisfying sexual function later in life. Now, does that mean every man should be focusing on prostate stimulation? Not necessarily, but it does mean that every man deserves to understand that this small, overlooked gland isn't just a source of medical worry. It's also a potential source of meaningful, lasting pleasure, even if that's never been part of your story before. Now here's where it gets interesting, because to really understand what the prostate does during orgasm, you need to understand how this part of your body actually works. Let's start with the basics. Your prostate is located just below your bladder and wraps around the urethra, the tube that carries urine and semen out of the body. It's normally about the size of a walnut, though it can grow larger with age, which is what leads to those urinary symptoms many men are familiar with. But beyond its role in fluid production, the prostate is a muscular gland that plays a surprisingly active part in climax. When you approach orgasm orgasm, a series of things happen inside the body, most of them involuntary. The pelvic floor muscles begin to contract rhythmically. The prostate, at the same time, begins its own sequence of muscular contractions. These contractions don't just move fluid, they actually intensify sensation. Here's how. During climax, the prostate contracts roughly once every second or so, often in coordination with the bulbospongiosus muscle, which is one of the primary muscles involved in ejaculation. The more coordinated and rhythmic these contractions are, the more intense the orgasm tends to feel. According to research from WebMD and reviews published by the National Institutes of Health, prostate-driven orgasms may involve as many as 12 to 15 contractions, compared to 4 to 8 during a typical penile-focused climax. These contractions create a deep, radiating sensation that can be felt not just in the genitals, but throughout the pelvis, lower back, abdomen, and even thighs. Some men describe it as a wave. Others say it feels like a full body release. And for many, especially those exploring this later in life, it can feel different from anything they've experienced before. Now, let's talk about nerves, because that's the other half of the story. The prostate is surrounded by a dense network of sensory nerves, some of which are connected to the pudendal nerve, pelvic splanchnic nerves, and hypogastric plexus, all of which are involved in sexual arousal and climax. These nerve pathways don't just relay information, they enhance it. When the prostate is stimulated, either directly or indirectly, such as through the perineum, the area between the scrotum and anus, these nerves send strong sensory signals to the spinal cord and brain. In simple terms, the prostate acts as an amplifier. It doesn't just contribute fluid, it increases the quality of sensation. And here's something many men find empowering to know. This network of nerves often remains highly functional even as other systems decline with age. Erection changes are common after 60, usually tied to vascular health, testosterone levels, or medication side effects. But the prostate and its surrounding nerves often remain quite responsive. That means even if erections become less firm or reliable, the potential for intense, satisfying climax may still be fully intact, especially when approached with awareness and care. Some men even report experiencing orgasms without erection at all, particularly when stimulation is focused more internally. And while that's not everyone's goal, it shows how adaptable the body can be. It's not your fault, but it is your body talking to you. And what it's saying is that there are still ways to connect, to feel, and to enjoy your sexual health, even if things look or feel different than they did at 25. One more point. The refractory period, that time after climax when most men feel spent and unable to become aroused again, can sometimes be shorter when orgasm is driven through the prostate. This isn't a guarantee, but the way nerve signals and hormone release work during prostate-centered stimulation seems to allow some men to experience more than one orgasm in a shorter window of time. Again, this isn't about chasing performance. It's about understanding that the body is more layered, more capable, and more responsive than we've often been told. So if you've ever felt frustrated by how aging has changed your experience of pleasure, or if you've assumed that your best days are behind you, know this. You're not broken, you're adapting, and your prostate may still have something important to offer, not just in function, but in fulfillment. This leads directly into the steps we'll share in just a moment, and they're simpler than you might think. Here are 5 safe ways to support prostate health and potentially improve the quality, intensity, and consistency of orgasm as you age. These aren't quick fixes or overhyped trends. They're grounded in clinical understanding of male anatomy and aging, and they've helped many men feel more informed and more in control, without shame, pressure, or risk. Let's begin. 1. Learn the anatomy. It's more empowering than you think. Understanding where your prostate is and how it functions is the foundation of everything else. The prostate sits just below the bladder and in front of the rectum. It produces fluid that mixes with sperm during ejaculation and contracts rhythmically at climax. But what's often overlooked is that it's surrounded by sensitive nerves, and that stimulation, either directly or indirectly, can enhance the intensity of climax. You don't need a medical degree, just basic awareness of how your body is built. For many men, this alone clears up confusion and gives permission to explore with confidence instead of uncertainty. 2. Try gentle, external stimulation through the perineum. If you're curious about how to engage the prostate without internal techniques, the perineum, the soft area between the scrotum and anus, is a safe, accessible place to start. Applying gentle, steady pressure here, with clean hands, light massage, or a warmed compress, can stimulate the nerves connected to the prostate without entering the body. Some men report deeper, fuller orgasms just from this external method. It's discreet, non-invasive, and a respectful way to explore sensation with or without a partner. 3. Support your prostate through movement, hydration, and regular release. What's good for your prostate is good for your whole system. That includes staying well hydrated, minimizing prolonged sitting, sitting and doing simple pelvic floor exercises like Kegels. But another important factor is regular ejaculation, with or without intercourse. Several studies, including findings shared by Harvard Health Publishing, suggest that frequent ejaculation, around 21 times per month in some studies, may help flush out prostate ducts and reduce the buildup of inflammatory compounds. It's not a magic number, but it does support the idea that regular release, within your comfort and lifestyle, can benefit both prostate function and overall sensation. 4. If exploring internal stimulation, follow clinical safety steps. Internal prostate stimulation, whether with a well-lubricated, gloved finger or a specialized medical-grade device, can be safe, clean, and deeply satisfying if approached correctly. Start slow. Trim nails, use unscented water-based lubricant, and make sure the area is clean. Many men find lying on their side with knees bent is the most comfortable position to begin. And communication is key, especially if you're sharing the experience with a partner. If you're unsure whether internal exploration is appropriate for you due to hemorrhoids, enlarged prostate, or rectal sensitivity, talk to your doctor first. There's no shame in asking, and no pressure to try anything that doesn't feel right for you. 5. If something doesn't feel right, speak up. Painful ejaculation, blood and semen, sudden changes in orgasm sensation, or increased urgency with urination should never be ignored. These could signal prostatitis, benign prostatic hyperplasia, or even early signs of prostate cancer. That doesn't mean there's reason to panic, but it does mean it's time for a conversation with your provider. Many men wait too long because they're embarrassed, but prostate issues are common, especially after 60, and your doctor has seen it all before. The sooner you speak up, the sooner you can get the answers you need. Remember, supporting your prostate isn't just about health. It's also about agency, intimacy, and confidence. It's about knowing what's possible for your body and respecting that pleasure doesn't disappear with age. It evolves. You don't need to change everything overnight. You don't need to chase a version of yourself from 30 years ago. What matters now is listening to your body, staying informed, and acting with care and intention. And always remember, all information provided in this video and channel is for educational and informational purposes only. Always consult a medical professional about your specific circumstances and before making any changes to your lifestyle, diet, supplements, or medication.